Welcome to Talk Legal to Me with lawyer Gordi. Today we have a very, very special guest. She's my bestie of 23 years. She is an attending at a prominent hospital here in Phoenix, and she has a podiatry background. She has a ton of cool stories that she's handled medical cases on and a lot of insight for people who are seeking a degree in podiatry. My bestie, Dr. Marisse Lardizabal. Well, welcome, Marisse. Thank you so much for coming on my podcast today. How are you?
Good. Thank you so much for having me, Gordi.
Yeah, we'll just pretend like we didn't go to dinner
I
last
know
Thursday.
exactly.
Anyway, but so you are my best friend for 20 years. Can you share an interesting story for the viewers and followers and something they may not know about myself or us?
Well, yeah, I think our friendship definitely flourished probably, I would have to say, like in college and then even after. I think that was the best thing. I moved to LA and I remember Gordy was always someone who was always checking up on me. So I was like not like alone. And I was like, and then she actually came to visit. So I was like, oh my gosh. I was like, this is like the best friend, like so I think from then on I was like, we're like sisters from another mister.
Totally. I feel like we've always been there for each other through our career climbs, motherhood, and all ups and downs. And
I think like the other thing that was like really even more bonding is I think we would always try to go out on the weekends, and then might live so far away from, and then it was always okay to like sleep over at your house. And then your mom would always make like crepes and stuff. And so I remember we'd always get like takeout after we'd come back. And then your dad's like in the next morning, he's like, I've heard you guys talking. Are you guys talking already at the getting ready? You guys are talking at the club and you're still talking in the morning while we're eating our food. I was like, yeah, I guess we did talk a lot. We're talking a lot in the morning. I'm like, I'm pretty sure they wanted to kick me out after a while. So.
No, you're like the third sister. You're the third sister, and like a Serbian or any ethnic family loves feeding any of their guests. But like,
exactly,
we almost like whenever we were apart, I felt like our friendship would just pick up from wherever it left off. And then, like you said, like we always just had things to talk about, and it was never like about people. I felt like it was always about like goals and aspirations and like things we wanted to do.
Yeah,
and I just love that. So, well, you are a podiatrist. So tell the viewers how you got into that, because it's such a specialized field.
I think I always liked being in medicine, or wanted a career in medicine. I think in college it was kind of like maybe harder with like all the sciences because I feel like I wasn't so much of a science person. So I did switch my major to from biology to art history, and practically because there was just an Italian trip that I wanted to go to over the summer, because you guys did study abroad and that's how I was like, I want to do that in college. So then for some reason my kind of mediocre grades went really, really high. Like I graduated pretty well. But then I did study fashion after that at FITM in LA. That's why Gordy visited me there for that year. And I worked there like in the like Calamart and stuff. And it was something I liked being in, but I always had like this inkling that I wish that if I had my ducks in order, like I have with art history and fashion, maybe I could have just done medicine again. So it's always that kind of this dichotomy that I was going back and forth. Ultimately, I moved back to Arizona because I kind of felt lonely. I wanted to be with my family and I really wanted to try again what I wanted to do. Then I was researching some other specialties because I've always thought surgery was interesting. And I researched, there was a doctor who was an orthopedic surgeon and made a shoe collection essentially. And I was like, this is such a great like meld of my like interests, like design and then maybe some design of footwear and like and medicine. So maybe trying to make the right shoe, which is always my mom's like wish. She's like she does not want to wear old lady shoes. So I'm still working on that. I'm still working on that. Yeah. So then I found podiatry, which was really great. I went to visit a lot of doctors and see like it was such a good number one. I think people always sold it as like a good balance, like work life. You could be as busy as you want with surgery, with trauma on call, with clinic versus you just wanted to just see clinic patients and you'll do great. So that was always really good. The flip part is you did a residency, which is good. So you actually treated the whole body, not just like the foot, essentially. So
So you're trained on the whole body, not just the foot.
well, usually our first year, like I especially did it at the county hospital here in Phoenix, and so our first year was a general surgery internship. So we got thrown
Wow.
on stuff that was not foot related, even
Right.
though we were podiatrists, my co-resident and I. And so you learn a lot, and especially if you're treating, like most of my patient populations have diabetes, heart issues, blood flow issues. You kind of do have to learn about the whole patient and actually find out and figure out who to send them to help you out. Like if you have wounds that don't heal, so you definitely have to talk to a vascular surgeon, talk to their primary care doctor to make sure your
Right.
diabetes is controlled. So essentially, it's good to be kind of well versed and talk to people with those.
Everything.
Yeah.
Yeah.
So
Do you feel like that's a common misconception people have about podiatry is that they think you just handle the foot?
sure, definitely. I feel like in the outside, in our hospital, we are known to do kind of like pre do pretty much everything, and we're like kind of talk to a lot of the services. But I think if you're like sometimes in private practice and you're like on your own, it's going to be hard to find that like support group with like a vascular surgeon, a
Right.
primary care, because you're getting patients, but then who do you send them out to if you need some help with them? So of course people will be like, oh, you do fractures. I mean, I've heard that, like even some residents my first year is like, do you guys do fractures like in the foot? I'm like, yes, we do. Anything in the foot usually we'll do, you know.
Right.
I mean, we do a lot of wound care essentially, but depending on the training, and it's great about podiatry now, you can be kind of you could do fellowships in different areas like sports medicine and trauma. So diabetic, Charcot stuff. So
That's really, really cool and insightful.
yeah.
What is a case that you've had that you feel like has been something that is stuck in your mind that you worked on?
I will say I know that we've done a lot of foot cases, but I think what stuck in my mind that I really liked what I was doing was probably my first year, and it wasn't a foot case. It was in a general surgery clinic, and this lady had like a little bump on her forehead. It was a lipoma, and the attending, which is like kind of the head doctor, was like, "Do you want to take it out since you worked it up?" And I'm like, "Sure." And you could definitely do it when the patient's awake with like a local block and stuff.
Mm-hmm.
And I'm like sitting there, I was like, this general surgery attending is trusting a podiatry resident essentially to do this for some odd reason. And he's like, okay, well, I'll be out to lunch and you just let me know. So what are you going to do? And I was like, well, you block it. And I had a plastic surgery rotation before that. So I had really
Wow.
great teachers to kind of like, okay, so you dissect down, I'm going to take some skin to like close it and close it without a scar. So that's what I've seen them do. So I'm gonna do
Wow.
it. So the nurse and me, and I'm blocking it. And I was like, this is like to a point where you're like, wow, one day you're gonna be on your own and you really have to study and like know like surgical planning, your vessels, your anatomy, how to do stuff, because you're just gonna be kind of there by yourself in a sense.
Right.
So all in all, it ended up really well. It was just a little lymphoma is a fatty tumor, and they can be found in the foot too. So they just kind of pop out after a while, and you just clean it and sew it out.
Wow.
So I was like, that would be my first time. I was like, wow, I really like it, and I really have to take it seriously, because if you don't really know
Right.
how to go about it, and someone's actually trusting me on their face, it's not their foot. So
Right.
and you try to
Yeah.
do it like within like not in a wrinkle area. So
I love that that was one of your most memorable examples because it took something that you knew how to do, which was doing that at the foot level. And then this doctor entrusting you to do it on someone's face, basically applying a skill set you knew and giving you that independence to really like navigate that on your own. It must have given you a lot of confidence.
yeah, I think I don't know if it's just looking back, me being like I was willing to do anything because you're just so excited to do stuff. And I probably should have said, no, I'm not sure about doing it. But for some reason, I was just like, okay, I've seen this. I mean, I could figure it out, And so,
Right.
and the lady was so nice. She was so happy. And I saw her for post ops. And I was like, oh gosh, it turned out great. So, but I'm like, okay, from then on, I was like, you have to be like on top of your game whenever you're doing like a surgery on someone. Someone's family is entrusting
Right.
you to do stuff. They're entrusting you to do things like to basically cut them open without, a
Right.
consent that's like battery,
Yeah.
essentially.
Yeah.
That's what we were taught in school. So
Yeah.
I
I
think
think it's
those
true.
are things like those are little things that help build your confidence, or else I could have been like, no, I don't feel comfortable doing that. Can you show me? Which is great. And I think I had a lot. I think I had back then about a few months before of a lot of little rotations. So I kind of used what I had learned in a short term and then kind of like put it together and like I feel comfortable. And if there was ever an issue, I would just call the attending. So and
Right.
that's I feel like how I am with my residents now. So
So talk a little bit about that. Talk about your position right now and what you do for the hospital.
after residency, usually residents get jobs, and essentially they could go private or in academia or like a group setting clinic. So I kind of decided I actually got offered a job and to stay with the hospital group at my residencies.
Oh, wow.
So,
That's great.
so it was really good. It was basically like it's just like you didn't have to really look for anything and it was a perfect work environment. So it was like what it's like striking gold, you know. It was like
Right.
loved working there. Everyone's so nice. The culture's great. I have great coworkers. So essentially for as an attending, you are responsible for residency training. So kind of when I was a resident, so like the 3 years after podiatry school or any medical school, you have a residency training. Depending on your specialty, is how long it is. For podiatry, is 3 years.
Right.
And so usually we didn't see the first years because they would be in the general surgery rotation. So I would always work with the second, third year. That's changed now. But we're geared towards teaching them in clinic, like how to manage patients, in
Mhm.
surgery, how to manage surgeries, prepare for them. And
Wow.
then we do have everyone's at conference. So it's like some academics and basics studying to get them ready for boards. So
Oh, wow, that's great. That's really, I feel like that's such a perfect position for you because you're so personable, you're so youthful and vivacious that I think that you can really be someone that your residents can relate to. You know, they trust you, but they still feel like, you're young enough that they're taking you seriously. They like trust you.
sure, sure. No, and it's true. And I have to say they're getting younger every year. And my coworker and I are like, well, we're getting to that point where yeah, we're a lot older than our residents. But it's definitely great because not only residents, so I have a few medical students every month also. So
Okay.
so there's a big party of us usually and trying to
Right.
let them learn. So they're usually like a fourth year. So they're about on the cusp of getting a residency. So they're trying to
Okay.
figure out like what I did fourth year. I did my like rotations at that county hospital and decided that this is a hospital for me, even though I don't know what I'm doing and what to expect. But for some reason, the students are a lot more smarter than we were back then, and I was just like, I'm just going there, you know.
Yeah.
They have a lot of very insightful questions and very intelligent now, so I'm really glad like that's like the future of the career.
Oh, that's great. Yeah, for sure. We're going to be in good hands.
Hopefully, yes, your feet are going to be good hands.
Yeah, there you go. I like that. So, in personal injury, attorneys work with doctors quite a bit because our clients are obviously injured and they need medical care. How do you think lawyers and doctors can work best together in those types of cases and collaborate?
I think definitely, I think the first thing is networking because up until like maybe recently, I was like, wow, there's actually a big push to kind of do like a lot of personal injury for like podiatry or any other specialties also.
Right.
Or like as workers comp kind of the same kind of thing.
Yes.
So I was like, well, that's actually kind of cool. So the first thing to do is like network, you know, kind of, I mean, I'm lucky enough to know you already. So
Right. Vice versa.
whenever I have a patient that got injured and they're looking for some, I guess, justice and some help because they're kind of like have no answers or not even well versed in like, oh wow, you should pursue something because this doesn't seem like it happened right. I always give them your number and I think that's the best way to kind of and see what you think. You may not be the lawyer for them, but at least
Right.
give them some information
Right.
on like what they could be doing. I think that just having that because otherwise no one would ever know to tap like that type of like education or like some
Right.
like referral essentially.
Right.
No one would know until because I've only known you and you tell me these things. So
Right.
that's
Yeah,
definitely one way.
definitely that network I think is super important. And then like from my side, I feel like knowing like, a lot of times like these clients get hurt and they have injuries and they really don't know like what the next step is.
Sure, exactly.
And they'll tell you what their symptoms are. Obviously, we'll get their imaging done and like we'll see what the results show. And, they might not be guided by their doctor. So it's like having, somebody that you have in your network that you trust
Mhm.
that does podiatry, that does neurology, or whatever the case may be, and being able to have, patients have access to a greater network of doctors that are trustworthy is always great.
No, definitely. I think recently, probably within the couple years, I had a patient who was hurt at work, and it's been a couple years, I guess, since her case was open. And I know that she was sent to me for like a second opinion. And it's good that she kind of pursued it because she did probably have an injury that I don't know exactly what happened in the first doctor, but definitely I suggested that, she needed surgery and like physical therapy after that. And then I know that she already had a lawyer, and
Right.
basically like she's like, well, no one's ever told me these things yet, or my doctor wasn't like so thorough in a sense. So I'm like, um so for her, at least she's more lucky to have someone like she already knew what to do for her injury and like how to
Yeah,
go
that's
about
great.
versus like you're kind of sitting at home and like no one's kind of helping you. So
Right. Right.
um so that's kind of a more recent case that I had that at least like for a second opinion was like that's actually really good, to
Yeah.
see if someone like corroborated the word the
Right.
like what the findings were, what the results were. So
Yeah, second opinions help a lot because it's exactly what you just mentioned. It's taking a look at the findings from the first doctor, physician, and seeing if the second physician agrees with it. So like not only in the medical field, do sometimes people seek out a second opinion, but in the legal field as well, it's just like bolstering the case to show, hey, this person really has these objective injuries because not only one doctor said it, but a second doctor said it too. So
mhm.
it must be true.
Yeah, exactly.
Yeah.
It made her case stronger. So I haven't heard back from her, but she was a nice lady. I hope
Hope she's
everything. I
okay.
know. Yeah.
Yeah.
So.
Well, I've had a case in the past. My client actually, he wasn't wearing his seatbelt, which is a huge no-no. And he was in the accident. And of course, with the impact, he tried to brace himself and stuck his foot out in
Mhm.
the floorboard to try to catch himself.
Mhm.
It ended up being a foot issue. How is something like that that's acute from a motor vehicle accident? How do you recommend patients recognize that this is a podiatry issue, that they seek treatment accordingly for something like that?
So sometimes what we've also learned, like in trauma, like not all your injuries are going to come about right then and there. So usually
Right.
I mean, within 12 hours or so, like if it starts getting worse and you feel like you can't put pressure on it, I think you need to seek medical attention. But
Okay.
usually if they go to the ER, they would possibly take an x-ray, and
Mhm.
that just looks at the bones. So sometimes you may not see everything there, and especially you won't definitely see a stress fracture yet. So um,
What's going to show you a stress fracture?
usually an MRI.
Okay, so
So
they have to bypass CT.
yeah, since CT is going to look for like how your joint spaces are. I would say if they're looking for it for like a
Okay.
bony like congruence, they'd want to look for if you have like a lot of multiple fractures that you can't see on the x-ray because it's a 2D view of the foot. So at least with the
Right.
CT they can kind of rebuild like a model, and we can kind of see where it is for surgical planning and stuff. But MRIs will definitely look at a stress fracture, or I'm thinking in that patient where if he stuck his foot in the floorboard, his ankle bone, which is the bone below your leg bone, got shoved in, and it kind of caused what we call like a osteochondral lesion. So it's
Oh,
like a little
wow.
bruise on the talus, which is the ankle bone. And so definitely that's going to show up because it's going to be like a little bruising, which is blood, collection of blood, and it's going to show different signals on the MRI. So
What kind of treatment do you think someone who has that they should undergo?
So usually it depends. I would say if they're a surgical candidate, if they're a young person, usually, and depending on the size of the lesion, they
Hmm.
could definitely do like a ankle scope, and then they could do like a what clean up and like a debridement, and that's a really non-invasive. It's just basically two poke holes, and you got a camera looking there. Sometimes if it's in a hard area, they may have to open up and take some
Right.
bone down and kind of add some other fancy stuff, or depending on the size, they could need a graft. So
Ooh.
from another bone. So
Right.
depending, that was actually one of the other cases I've ever had where it was a young kid and we ended up doing like an open one because it was such a difficult spot and he couldn't work. I think he was injured in a car accident, and he ultimately wanted to do the surgery and then actually went back to work after. So it was
Wow.
kind of actually really amazing because you
Right.
only read it from like the textbook. I'm like, does that really work? And then when you
It
kind of
actually,
do it, yeah, and in practice, he was so much happier, you know.
okay.
Um,
There you go.
so usually, but let's say if that's he's not a surgical candidate, it's not so bad. You know, you could kind of keep him non-weight bearing, meaning wear a boot and like a knee scooter for 4 weeks to 6 weeks. So that's like bone healing time for us, and take another X-ray, see how it is. So.
Okay. Interesting. Now, you said two things that I wanted to really capitalize on and have you elaborate. You said that injuries generally will not present themselves for about 12 hours. And that's something that we see a lot as injury attorneys is you have the police officer who's writing the police report saying this accident happened, no injuries, you know, nothing to report. And then we've got the insurance company that takes that police report and says, hey, you know, how's your client injured? Because at the scene, no injuries were reported. So elaborate a little bit more on when those injuries really present.
So I would say, like, I mean, maybe to correct it, it would be like if they wrote no visible injuries, like an open laceration or a cut or anything like that, that's bleeding, you know. But definitely, like, I've had patients who have, I mean, not in an accident, but maybe fell off a step and they thought they're okay. And then all of a sudden the next day, and they try to put pressure on their foot, it's red, hot, swollen, and they can't put any pressure. So I would say either sounds like a fracture of something or a rupture of a tendon. So they felt fine after doing it, and you know, went about their day until the next morning when your body's like, hold on, you're hurt, we need to do stuff right now. So their foot's swollen. So
you need to see Marisse
you know?
now.
Yeah.
The other thing that you mentioned that I thought was really important is the importance of an MRI. So, you know, I'll have clients look at the x-rays maybe in the ER and they'll be like, I have these x-rays and it looks okay, but I'm still having issues. And then, you know, the MRI is where it really is going to show. Talk a little bit about that and how that's super important.
Yeah, the super important, another thing is an x-ray, yes, definitely 2D view, but make sure actually a specialist looks at it, because ultimately what I've run into is people just read the findings, which whenever I want a previous x-ray or something from a different site, I don't want the read, meaning no acute pathology. I want to actually see the image myself, because I don't even look at that. I just read the image already and I know what I'm looking for. So I think you should have a specialist look at it, because we do read our own x-rays. The MRI is important because it will show like soft tissue stuff. So sometimes, again, we have some maybe complex fractures and some ligamentous involvement, like especially in a sprain. So some of these get ruptured, and usually you can only really see those on the MRI. And of course, physical exam, you know, we know that they have pain in a certain area where the ligament is, where the tendon is and stuff. So how the foot's position, how if they're having pain during like weight bearing versus non-weight bearing, or when they're sitting. So those are all going to be helpful with the MRI. At least give us more like surgical planning, I guess.
There you go. And then with that insight that you're getting from the MRI, then you can really direct their care better on something that's really going to alleviate their symptoms. Is that true? Or
definitely, yeah. Because usually it's kind of the option of like, do you feel like you want to do physical therapy, or if that fails, we can try surgery, you know. Those are kind of like the flow chart where you would get the MRI from. I mean, sometimes what's really good is sometimes it doesn't show anything. So then it's like maybe it's like a contusion, like maybe it doesn't show something and you just need some rest and physical therapy, and most people are fine. So there's kind of a lot of deviation on where you want to take that finding. So
interesting.
A lot of options. So
yeah, well, that's good. It's better to know than I always say it's better to know definitively than to have a gray area and not know, but you still have this like lingering symptom or issues that you're not treating and you kind of don't know because the x-ray is not really giving you the insight that you need.
Exactly. And I think with that other case with that lady who got hurt at work, her MRI that we took, another one, still showed the same thing that she took 2 years ago. So it was really good. And I was like, we had our recommendations were pretty much the same. So
Right. No improvement, even though time has lapsed.
yeah,
Generally means maybe they need surgery or something more invasive.
exactly.
Okay.
So.
I remember, so it's kind of funny. I remember you and I met for dinner once, and I was like, "Yeah, what'd you do today?" And you're like, "Oh, some guy had, as a patient, he only had 4 toes, and I made him a 5th toe." And I was like, "Well, that beats anything I've done today because I fought with insurance companies, I spoke to clients, maybe got some settlements, but like creating another toe, like that is something else."
Well, I mean, it was like probably what I can't just wait. We may have to cut. Which one was that one?
I don't know. I just remember that was like a story I remember her telling me where
Did
she
I
was like,
make?
I created a 5th toe
No,
today.
no, no! Don't say that.
Yeah,
That'd
you
be
did.
funny.
You said
Did
the
I?
guy had like 4 toes, and you like cut one of the toes, and you made it into 2.
Oh! I see what you're saying.
Right?
I like a syndact. Like so, her toes were born together.
I don't know.
Yeah, and then
you
you
just said the person
basically
had 4, and you made 5, and I was like, wow.
Yeah, there was one where I like they were like webbed, and I cut them.
Okay, yeah.
And I made
we could
it
talk
like.
about that.
Oh, okay. It's like a little kid.
Oh,
Actually,
okay.
yeah. Yeah. So, okay, I get it. I was like, what did I make a 5th toe? What am I saying? So that surgery. Oh, those actually was a really fun one. I saw like a little girl, probably actually kind of, I saw a lot of really interesting ones early on. So,
How old was she?
she was probably 7 or 8.
Okay.
So she came in with her toes kind of stuck together, called like syndactyly. So I guess usually they're fine. They won't have an issue with anything, But I think the big thing is her parent was saying there she was being made fun of in school. So she really wants to get it fixed.
Okay, so like cosmetic more, not like
Sure, yeah.
running, walking, balance issues.
Sure. But I mean, it would cause pain because she's trying to it's painful in shoe gear. So I'm like, okay, then that's fine. It looked like a total, just looked like her 5th toe was stuck to her 4th toe.
Okay.
And then I took an x-ray, and it turns out maybe she's having pain because she had an extra bone there.
Oh.
So
okay.
I guess, okay. And then I told mom, and they were on board with like a surgery. So we desyndactylized it. So we kind of opened up skin. And that was actually another one that I worked well with, like a hand plastic surgeon too, because you have to get a skin graft to cover one side that's going to be open. So,
right.
So it's actually really good planning. I like those surgeries where you have to plan a lot, despite you may never go that way that you plan. You have to be prepared for that.
Where'd you guys take the graft from?
So it's kind of, I don't know if I can, it's like from a groin graft.
Okay.
So basically wherever you would have like an extra pair of skin. So for extra piece of skin essentially that no one would notice, that would be tight if you move. So usually in girls, and I guess guys, it's like where the bikini area would be.
Right.
So there's a lot of skin redundancy there.
Wow.
So he took it from there. Like I made a little pattern of how much skin I needed, and he took it there and we sewed it, and we kind of like did like a little dressing to kind of let that heal, and she healed fine.
Fascinating.
Yeah, so
fascinating. You made 4 toes into 5. Like it just blows my mind. And you have a fashion background. Do you ever feel like you went to FITM in LA, like you talked about? Do you ever feel like the classes you took there, because you just talked about you creating a pattern,
yeah,
and then the surgeon using that pattern. Do you ever feel like there's an overlap with your FITM background to your surgical background now?
I feel like definitely. I feel like as a kid, I've always been good with my hands, because it would drive me nuts to probably have a desk job, because I would need to be like doing something. Like, I think probably why I've enjoyed arts and stuff like that. But definitely when I look at some of these surgical books, when they have like a little drawing on like what to do, it's like basically like a pattern guide, like sewing pattern for clothes, to feel like, okay, so you need to cover this area, cover that area, how to make it so that it looks cosmetically pleasing. Do I push the skin forward? And definitely, I mean, and you could, I used to try to test it on some paper, like if it would kind of fold in, because it's hard to read off of a book, but you have to kind of try it in real life with what you have, like towels or something, to like see how they fit together. So I think having that background definitely helped, kind of see like what looks good, or like how your ideas on closing a flap, like, so.
Very cool. You're a wife and a mom and a professional. What are some of your goals and aspirations in your professional and personal life?
Professional life. Well, I feel like I think trying to do a little bit more research would be good. That's one thing that I'm kind of also like, I'm not really familiar with, nor there's something like, I don't know, I feel like I want to do something so different, but I need to build up some interest. So I kind of, it's more intriguing like that. So I have to like kind of want to research more into research,
Okay.
kind of look into, and we have a really good collection of patients that we could definitely do some research projects on. So I think that's something that is unknown that I would like to pursue.
Awesome.
Um,
What about personally?
Personally, I feel like, of course, being like a mom, like just like you, like how to balance like work life is and family life is definitely difficult, I have to
Right.
say, but it's really rewarding, I have to say.
Right.
I have to say, even though it's kind of tough to do both, I couldn't just do one of them, I
Right.
couldn't just, be stay at home or just be at work. It's kind of really fun to do both, because then at the end of the day, it's like, wow, all this stuff happened and it's really great and it's exciting for the new day, like
Right.
what's going to happen. Like no day's the same essentially. So,
Absolutely.
um, I think that that's kind of a challenge, but I kind of secretly like it,
Yeah.
in a sense. Like, some days it doesn't work out, how you planned, and but at the same time, it's nice to come home to a family. I think
Yep.
that that's good, and definitely for when I was a woman before I was married, I was definitely happy, with my career choice also. So, but I
Awesome.
think not setting up with like such a really serious, I don't want to say serious, but not like a very stringent goal, like I have to do this by this age,
Right.
really made the journey to where I got now really fun.
That's
And there's,
awesome.
yeah, I wasn't expected, like didn't need to be married or didn't have to get kids at the certain age. It was just like, I'll go this way, how it, how it is. And it kind of built how my um life came about to be,
I
so.
like that because I feel like there is a lot of that pressure, especially on women,
Mhm.
to be the wife, to be the mom, to be the professional by certain ages. And if you're not, it's almost like you're a failure. And so I really like that approach. And you always did have that approach. You just were going where life took you and you never set these like timelines. You always had
Mhm.
goals and aspirations, but you never set these like hard timelines and pressures on yourself
Mhm.
because inevitably I think that leads to a lot of unhappiness. So,
Oh yeah, definitely. I feel like if someone's um like giving you like comments about your life, that's not potentially like what you wanted to do, like what if someone said I wanted to get married but I wanted to go to podiatry school, like I would not be happy,
right.
so.
What's advice that you would give to anyone who would like to pursue a career in podiatry?
Definitely. I think seeing a lot of medical students, I always ask them this question. So I think uh definitely seeking out a podiatrist and see uh like what makes them tick, how does their clinic run, like why did they pick to do podiatry, why they pick doing, um like private practice versus something. So I get a lot of questions asked and stuff based on that. So I think definitely looking up a podiatrist, visiting a school, is good,
Right.
visiting and I think a lot of them have had injuries themselves, and then
Mm,
they've actually kind of followed that podiatrist along the lines and actually um, like furthered their career with it. So
wow.
I would say that would be the biggest thing. Be proactive about it. So trying to like seek out the offices, kind of knock on their doors and be like, I'm a potential student. I want to know what's the ins and out. What do I need to learn? How do I study?
What does it take to
Yeah,
be
what does it
someone
take?
in this
Definitely.
profession?
Yeah.
I like that.
Visit stuff, I would always say to students or even my residents, like nothing's going to come to you.
Right.
You're going to have to knock doors and something you're going to get no's, but it's like, what's the worst that could happen is a
Right.
no.
Right. Thank you so much for coming. This was so much fun. I love talking to you about your profession and how you got into it and you sharing all your knowledge with the viewers.
No, I really appreciate you having me. I was like kind of like worried. I'm like, what will I say? What are people going to be into? So, no, thank you for having me. It was actually fun to discuss some things that I've actually never really brought to life, I guess, so
Thank you so much. I appreciate it.
thank you.
Thank you for tuning in to Talk Legal to Me. Remember, you can listen to us everywhere you get your podcasts, including Spotify and Apple. And if you want to watch along, visit my YouTube channel at Lawyer Gordi. Until next time, stay informed, stay legal, and stay fabulous, besties.